What do you
And I was
think
like,
the issue is, on that? I wanna hear both
oh,
of y'all's.
100%. It's everything that I talk about in my own program. I cover it in my own stuff that I do, as you guys know, but then I obviously introduce a huge part of it in protocol, which is basically an understanding of what's going on during these conversations. How are you structuring right now? I've finally started to present in its entirety for me personally, basically the art and science of a consult. I've been working on that for a decade because I've watched everybody go down a rabbit hole and it never makes any sense to me. I watched everybody talk to patients and everybody does the same thing. They start to have this conversation and the patient kind of somebody has to each person's going to
Takes it
hold
off
hands.
course. Yeah,
Who's going to now lead the
right.
conversation? Who's going to take the person down the path? And typically it's the patient pulling the dentist along a path that they don't want to go down. You've all seen this example, right? Mrs. Jones sits in your chair and goes, "It's really nice to meet you, Dr. X. So let me explain why I'm here. I'm thinking about maybe doing some things to make my smile look a little bit better. I had these two crowns over on my right. Those were done 2 years ago. So I really don't want to cut those off. So what I want you to do is maybe look at some of these and try to match this one over here." And you start having these weird conversations. And the whole time the dentist is like, no, 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 no. And there's no rhyme or reason to how these consults are done.
And
So
usually they acquiesce in the end. So just so we're clear, like, okay, I'll try because
yeah, right,
I
right.
want you to like me.
Right. I want you to like me. And they cave and start doing dentistry they don't want to do. So the big thing for me, what I was passionate about, and what I brought to the protocol was the ability to say, look, in a given amount of time, there's a structured way to do a consult. And if you follow these basic steps that are honed in cognitive psychology, social psychology, if you look at this and you understand the dynamics of it and you kind of script it through your brain about the steps necessary to have a conversation, it's huge. I asked my treatment coordinator to run the numbers, and I've had 4 no's out of the last 30 consults. So what is that?
That's
87,
yeah,
80,
I was gonna say
86,
it's
86,
12% not
86%.
accepted. Yeah, 88%.